Right, thanks for that, Olani. Now, the harrowing scenes from India continue to dominate global headlines as the country struggles with soaring coronavirus cases. Multiple states will go into complete lockdown in coming days as a second wave continues to paralyze the world's second most populous country. For more on this, we're joined by #OurStories managing producer Gunjan Bidani, who's live for us tonight from the Indian capital, New Delhi. Gunjan, good evening, and thank you so much for your time. Our Stories is such an important platform, especially during a time like this, because what is unfolding in India is really the human story. What are some of the things that you've seen?
Hi, thanks for having me. Good evening to you too as well. Well, unfortunately, the situation in India is still distressing, and there are millions of voices out there which are still unheard. People need support. People need support for basic medical needs like ventilator beds, like oxygen cylinders, like plasma donors. And they're struggling out there because the cities are lockdown and the travel's banned and no one can travel anywhere. It's just social media they're turning up to. So it's distressing out there.
What does a platform like #OurStories, what has it been able to do in terms of actually making sure that these voices of ordinary people who are struggling don't go unheard?
At the moment where everyone's kind of talking about the death rate and the number of cases which are happening, which is of course important to update, but that let alone would not solve the problem, right? So what we at #OurStories are trying to solve here is to talk about the solutions, to amplify that how people on the ground are really reaching out to other people who might be strangers, but they are just out there putting up their services on the social media and even like telling their stories. And we at our platform, as we speak, in fact, my newsroom is rolling out a story right now about this group who's, again, helping the people in need.
What are some of the things that have proven to be most challenging to access, especially for those who are in the midst of this crisis?
Of course, ranging from plasma, looking for that perfect plasma donor for a patient who needs plasma therapy. That has been a great challenge because people do not know that how do we find. Of course, COVID-19 has been mismanaged and underestimated, and that's why India is under agony at the moment. And in order to curb that problem, social media, people are like just turning up to social media and looking for ventilator beds, oxygen cylinders, and plasma donors.
You talk about the fact that COVID-19 has been mismanaged within the community. How much observance was there to just some of the protocols that have been spoken about, at least globally, whether it's the wearing of masks, the social distancing, the sanitizing? How much of that has been going on?
At the moment, since the lockdown is as the cities are under lockdown, of course, the protocols are being followed by the country and the countrymen as well. So those are being followed at the moment.
But has there been enough work done to understand how India has gotten into this position?
Yes, enough work was being done, but the reason we are underprepared at the moment because the cases surged so high, and between these two waves, there was some certain sort of relaxation as the economy was suffering as well.
What are some of the challenges in terms of running your own newsroom? Because sending journalists out there to cover stories, as important as it is, it also puts them at it exposes them to a level of risk where contracting COVID-19 is concerned.
Basically, we at #OurStories, we train normal citizens who are sitting at their homes to tell their stories. We are providing a platform where those unsung heroes, those change makers are just coming up and telling about their story through their mobile, and we are featuring them on our platform.
What have been the stories that have received the most attention or the most views?
So there has been stories where people are reaching out and helping other people in need for the services they're offering. And that's how we have received that people have come back to us and telling, okay, that's how we've helped them.
We're also hearing stories, just given the high number of people who are dying, about the trauma that many families are having to go through in this moment. Are people beginning to speak about that, or is it simply still too soon because many are just caught up in the moment of trying to survive?
Of course, trauma persists and it's a difficult situation we're all kind of like put in, but at the same time, we need to talk and amplify those stories so that it can be heard across, and other people who might be in dire need, they can understand and, be aware about the situation which might come forward. So people are stepping up and they are involved in the selfless act.
When we look at the vaccination rate, India has actually managed to vaccinate quite a high number of people. Of course, comparative to the overall population, that then becomes a smaller percentage. But how are people generally feeling about the vaccine? And are people just waiting for their turn to be able to get vaccinated?
People are waiting, and at the same time, with the best capacity which is available from the manufacturers, from the vaccine manufacturers in the country, people are availing that. But as you're aware, that India is an enormous country, so it'll take time. So yeah, we're on track with it.
All right, Kunjan Bidani from #OurStories. Thank you so much for joining us for this interview tonight.